People often need mitral valve procedures, either repair or replacement, when they have a dysfunction of their valve. This can come from a variety of reasons, but it's usually either a leaky valve or a stenotic valve that doesn't open properly. Leaky valves can usually be repaired. That means the patient keeps their own native valve, but we do some reconstruction work on it. Mitral valve replacement requires implantation of a prosthetic valve, an artificial valve. Minimally invasive mitral valve surgery is done through a small hole in the right chest. In addition, we put tubes in through the groin, not the valve itself, that goes in through our incision, but it's done without opening the sternum. Traditional open heart surgery requires a sternotomy, a big incision on the chest. As anybody who's had that operation can tell you, that hurts a little bit and it takes a while to recover. So the main advantage of minimally invasive valve surgery, patients recover more quickly. What's important for people in our community to know is that Grandstrian Health offers all the options for patients with valve disease. We have traditional surgery, we have transcatheter therapies, and we have minimally invasive valve techniques.